course, I wanted to thank all of our panelists for coming out today. Thank you for taking the time to have this discussion with us. It's very important not only to discuss healthcare policy, but to also discuss our response to COVID-19. Just want to give everybody a heads up. If you have any questions for the panelists, you can go ahead and post them in the chat or the Q&A, and we'll get to them as they come in. But just remember, try to keep it to healthcare and the COVID-19 response. All right, we're going to go ahead and get started here with just a quick centering activity. If we can just go around and talk about what is the most important aspect of healthcare to you. If you're an attendee, please go ahead and post in the chat what the most important aspect of healthcare is to you, whether that be quality care, affordability, etc. So I'll go ahead and give some time for that. Mia, did you want to start us off with an answer?
Well, I think that when I think about quality of care, especially when it comes to healthcare, is getting it to those that can't afford it. I had an opportunity because of the ACA to one time have 3 health insurance providers because I was doing National Guard drill and had to have health care. I was working at a contractor and I had to have health care. And then, of course, I had the VA health care. And really, none of them took good care of me. I had to basically find a way to take care of myself. And the VA took the best care of me thus far. So it is something that I learned that I'm willing to share a little bit more about tonight.
Perfect. Okay, Susan, can you go ahead and tell us what the most important aspect of healthcare is to you?
Well, because I'm in healthcare, I think the most important factor is our ability to provide it. We need to provide it safely, efficiently, and cost effectively, and we aren't doing that right now at all. I think the comment about the VA, Mia, is really important because we don't hear that often enough. What we hear is that we are not getting our service to our veterans as well as to our seniors. It goes straight down the line. We have problems with our healthcare system.
And Michelle, did you want to go ahead and add on to that?
For me, I think that accessibility is the first word that comes to mind because I can have access to affordable care all I want, but if I can't come up with the money to pay for it, it means nothing. So, I mean, when we talk about accessibility of healthcare, if there's even just one person who can't access it, it's not accessible. And that's something that we as a country really are way behind the rest of the developed world.
Absolutely. Yeah. Well, thank you guys for opening it up for us. It looks like someone else in the chat said access to affordable quality care, which is absolutely right. I'm going to go ahead and introduce our guest panelists today. So we'll get started with Susan Deline Botkin, who is the owner and family practitioner at Family Care of Easton. It's a nurse practitioner-owned and family-run practice with about 2,000 patients. Susan has won national awards for excellence of practice, excellence of diabetic management. She's also been active legislatively in Maryland and nationally, and has received recognition from multiple national and Maryland nurse practitioner organizations for forwarding the role of the nurse practitioner to provide safe, high-quality, and efficient health care. She currently lives in Oxford, and she has 1 son, 1 stepdaughter, 2 grandchildren, and 2 dogs. She was previously the president of the Nurse Practitioner Association of Maryland, past legislative chair of NPAM, the Maryland Association of Advanced Practice Clinicians, and a past member of the Talbot Central Committee. She's currently on the board of the Talbot Democratic Forum and the Oxford Board of Appeals and the Talbot County Board of Education. Moving on to Miss Michelle Gregory, she's the daughter of a British immigrant and public school art teacher. She moved to Delaware after high school and attended Delaware Tech and the University of Delaware. She then moved to Wicomico in 1996, married her husband Christopher, and they have 3 children, Nicholas, 26, Jessica, 20, and Daniel, 19. Michelle was an early childhood educator for more than 20 years, with hundreds of happy families and clients, and closed her business in 2017 to care for her oldest child, Nicholas, who has a rare form of epilepsy and many other health issues, giving Michelle a unique perspective to many topics from healthcare to education. Prior to being elected to Salisbury City Council, she was a founder and leader of the Lower Shore Progressive Caucus, an organization dedicated to empowering social, racial, environmental, and economic equity through electing progressive candidates, supporting progressive legislation, and working to create a government that works for the many and not for just the powerful few. Since joining the Salisbury City Council to represent District 4, Michelle has helped to move the city forward with police reform, environmental policy, and protecting workers and small businesses during the pandemic. And last but not least, our last panelist is Mia Mason. She's a 20-year veteran running for Congress in the 1st District of Maryland. She's the first LGBT candidate to pass a Democratic primary in Maryland. And she has a unique interest in Medicare for All, so I think we'll be touching on that, as well as some responses to the COVID-19 pandemic. So with that, we're going to go ahead and turn it over to everybody to kind of give your blanket statement and your general position on healthcare. You know, why you got into healthcare, Susan, where would you like to see the policy go, and kind of just your general broad comments. So we'll start off with Susan.
Okay, I've been practicing for 25 years in this area, and I originally got into healthcare because I saw the huge need that we had to have good quality practitioners. I have gone through the pre-ACA, pre-Obamacare, and to the current situation. I have watched my seniors have to choose between eating and medication. When we did have the Obamacare program come in and become available to folks, we were seeing people who hadn't had health care in 10 or 20 years. No insurance, they couldn't afford medications. They had been without diabetic medications for 10 years or thyroid medications for 5 years. It was an extremely serious stress on the system, but it was one of the best things that could happen, and I saw that as a step to the next area where we really should be having basic healthcare services for everyone in this country. And it actually will lower costs if we do that. I can go on.
Excellent, thank you. We'll get into it more. I'll turn it over to Michelle.
Sorry, I had myself muted just in case the dogs went off. So for me, having seen at least the patient side, I haven't seen the other side, the provider side, but for me, being on the patient side, you know, having a child on Medicaid who is disabled, who has gone through an unbelievable number of medical procedures and trials and tribulations. You know, for me, I feel very lucky that he's able to have Medicaid, but I'm also heartbroken that there are so many people who also need that program or something like that, and that don't have access to it. You know, there are too many people out there who, even with Obamacare, yes, we covered them up. There are still those that are uncovered. And then you've got states in the country that did not take the Medicaid expansion that Maryland did. And that left a lot of people behind. And I think, you know, we need to really seriously look at, you know, pulling the profit, because I've been on the phone with insurance, and back when my son, the Medicaid would take over the second half, and our private insurance would take over as his primary, and we would have so many arguments over his medications, and we've had at least 2 or 3 trips to the hospital because he went without. Trips that probably cost the insurance company a lot more than if they had just paid for the medication and given him the access to that medication. You know, and we're treating these people as expendable. You know, the disabled, the working poor, you know, all the people who can't get the health care they need. You know, they're being treated as expendable, and that's just not acceptable.
Absolutely. Mia, did you want to go ahead and touch on that too?
Sure. You know, sometimes it resonates best when we have a personal story to tell, and, you know, whether it's family, whether it's us, or, you know, our friends that are nurses, like our campaign manager, or my treasurer who works at Walter Reed, it makes a difference. I have to honestly say that when I had health insurance, the hardest thing for me to do was try to get my foot fixed. It took nearly 6 years for them to figure out, like, what's wrong with me. I've been infantry for about 4 or 5 years. I've been in the Navy. I've worn steel-toe boots for my entire military career. You know, combat boots is not something comfortable to wear, and it really damages your foot, and it damaged both of them. So to get that fixed, the VA really didn't want to do anything about it. They just denied me. And it took me till I got back on TRICARE for life after I retired for them to do something within, I don't know, 6 weeks to say that I needed surgery, because all the insurance companies wanted to do was go through a procedure, go to physical therapy, get you on pain management, pump you full of opioids, get you back into physical therapy, do another x-ray, wait till something else breaks, then maybe have surgery. Well, I'm missing a nickel size between my toe and my foot on both sides of my feet. One is done, the other one is still awaiting to get fixed. So we live through pain because our insurance providers have guidance and procedures that they don't want to get sued for by malpractice, but yet they don't want to give us the care because they want us to pay per month for our health care. And we have to be able to fight for that change by going to DC and getting it done. Yes, ACA was a stepping stone, but with other plans that are coming forward, like, you know, HR 1384 and Medicare for All, we can actually make an inclusive plan to bring all the Medicares together, provide vision, dental, provide nurses, you know, telehealth directly to our patients, provide healthcare that is going to make it affordable for everyone. And I'm looking forward to telling you more about that soon.
Excellent. Thank you.
I'd like to make one comment on Mia about telehealth. COVID has really opened up what we are allowed to do and to get paid for with the telehealth. Previously, we were not reimbursed for it. But right now, probably 35 to 50% of our practice is telehealth. We also have drive-by. We see patients in the parking lot. Some patients come in. It's very flexible right now. But the patients are telling us they love the telehealth. They get their Zoom, their cell phones out. They show us leg lesions like yours. They show us skin lesions. They talk to us, and they feel it's so efficient to be able to do that. And that cuts costs. It's a huge savings. And COVID, that's what it took to get that allowed by Medicare and by the health insurance companies.
Absolutely. So I guess kind of moving into transitioning to that, Mia, with your experience as a veteran, what issues have you identified with the VA healthcare system, and what solutions do you propose to try and fix those issues?
Well, so when I first came to the VA back in DC in 2013-14, I was being treated as a number. You're on yellow team. You're this. I couldn't even get into the women's clinic because they were like, until everything's straightened out, you're this, you're that. And I was like, okay, that's unacceptable. You know, I had to fight for everything I wanted to do, and then still, after it took nearly 3 years to get things fixed. You know, to not be treated as a number. It took nearly a suicide for other veterans who commit suicide 22 a day, all right, to get them to stop treating people like a number. Because normally if you go into a doctor's office and they talk to you like, yeah, how are you feeling today? Are you suicidal, homicidal, whatever? That's not the doctor that you want. You want a doctor that wants to greet you, talk to you, get to know you, get to find out what's exactly wrong with you, get you tested and treated. That's the VA I want. Those are the healthcare providers that I want for everyone, so that we're not going into, you know, political disputes about what's what in the military or in the VA, because the one thing that the VA is good for is taking away our veterans' money, making them homeless, and then they're sleeping outside of the VA, right in front of the VA in the parking garage, trying to get health. And the sad thing is they're only open Monday through Friday during business hours. Only a few VA centers in the entire country are open 24/7, 365 days a year. These are some of my plans that I want to be able to change in the future for our veterans, because they shouldn't be stuck in a parking lot yelling at security to demand for health care.
Mia, can I ask you, what about the big VA hospitals? Aren't they providing the care that you're talking about? See, this is something that the average citizen does not understand. We have the concept that the veterans have this huge system, and the veterans walk in and they're cared for from head to toe. And what I'm hearing from you is wrong.
Well,
that this is
we're
not
a
the
teaching
truth.
school. That's the VA. The VA is a teaching school. We're normally attached to, like in Baltimore, we're attached to the Maryland Healthcare Institute, or whatever it's called. I haven't been in VA, because the Baltimore VA, because now I'm being shipped out of state. So the VA is sending me out of state to West Virginia to get health care. And because I can do things online now, I can just talk to my doctor via email or Zoom like this. But, I can't go to Washington, D.C., I can't go to Baltimore, I can't go to Hagerstown, I can't go to Perry Point, I can't go to Glen Burnie anymore. Everything has, by the pandemic kind of shut down. But, where I used to go in Baltimore, they put up walls. Trump put up walls. So did the VA. They put up walls to keep us, locked in or locked out.
That's got to change. Got to change that when you get elected.
We shall.
Excellent. It looks like we have a question that came in from the chat from Marion. So the question is, when I was in school, half of us had Medicare and food stamps. Is it the problem that the plans are too expensive, or do people just not have access to Medicaid? I think that, Michelle, would you like to kind of touch on this question first? Just unmute yourself.
There we go. Okay. Sorry about that. To me, as far as people not having access to care, even if they're on Medicaid, so to give you an example of the trials and tribulations that we face, there is no dental care provider on the Eastern Shore for special needs patients. We would have to go to at least, I think it's the west side of Baltimore. So it would be at least a 2.5, 3 hour drive. So just because they say you can have it doesn't mean it's accessible, it doesn't mean it's there. The one dental provider that was down here for the entire lower shore and eastern shore in general was shut down a few years ago with zero notice. As a matter of fact, we had an appointment, and I found out going in there the next day after they had closed down. I found out that they had been shut down. The nurses were given no notice. And this because it wasn't profitable enough. It wasn't profitable for the people who had just taken over the facility because it was a privately run facility. So it wasn't deemed profitable. So now there's no dental provider for people like my son who requires sedation just for a simple cleaning. So, and you're not going to find a regular provider to do that. So when people they may have access to the coverage, but that doesn't mean the provider is available. A lot of these providers have long waiting lists. I don't know if you've ever had to call a specialist, but even for an emergency case, I would be looking at least 2 to 3 weeks to get into my son's neurologist. They're just that busy. Because in rural areas, the providers just aren't there. Mostly because the pay is terrible. So, because private insurers want to hold on to their profits and not pay the providers. We need to cut that middleman out entirely. We need a single payer system, because when we have that middleman, so my son has Medicaid, they actually pay another insurance company to handle all the paperwork and everything. And that other insurance company is the one who told me that he couldn't have the drug that he had been on for 5 years. That was the one proven thing that helped reduce his seizures entirely. And he went without it for 2 weeks, and guess where we ended up? ICU. So, because he seized, he aspirated, he was non-functional because he was without that medication. So, we need to cut these for-profit people out of the picture, because they're even in the picture when it comes to Medicaid. And it's a barrier, but that profit is a barrier between people and accessing the care.
Yeah.
Absolutely. Susan, did you want to go ahead and touch on this as well?
We're talking about the Medicare system, Medicaid system. Is that correct?
They said Medicare. Is the problem is that the plans are too expensive, or do people just not have access to Medicaid? Excuse me.
Okay, but we're talking about Medicaid. Medicaid in the state of Maryland actually has been pretty generous in reaching out to folks lately. And it's different. Michelle has a really interesting case and a very good point. We have Medicare, Medicaid, and that provides health care. Then we have the dental, which is extremely difficult to find, let alone vision care for our folks on the Eastern Shore, or anywhere, as far as I know, in the country, who need access to specialists. They will tell you that they don't take that particular Medicaid program. We have actually invited Medicaid enrollers into our office and then notified our patients who are unemployed or underemployed so that they could come in and register for these programs. During the pandemic, this is another thing that really was fortunate, that the state opened up longer enrollment periods, because previously it was only from about November 15th till January 15th that the enrollment was open. And it's too short a period of time for all the folks who really need these programs. Medicaid is extremely important, but we really need to have health care for all, regardless of what we call it.
Perfect. That's actually what our next segment is that we're getting into. So I'm glad that you touched on that. So speaking of Medicare for all or healthcare for all, a common objection to Medicare for all is the cost. So how can we fund Medicare for all? I guess I'm going to shoot this one to Mia to start off.
Sure. So one of the biggest things that y'all talked about was basically all of these programs, all of these special needs, all of these people that don't have it, who need to register for health insurance. Well, if they get an ID card, they should be able to get on the health insurance plan, Medicare for all. And we want to be able to expand this to make sure that it's applied to everybody, all ages, regardless of what family you are, and make it a price per year so that it's affordable based on your income. There are different brackets. There's a bigger plan for that. But the best thing I can say is, how can we fund it? Well, we need legalization of a lot of other things. That is a different topic that we had just with Progressive Maryland on Tuesday night. So if you want to learn more about those steps and how to raise funds for this, that is something that we will work desperately with the governor to make sure that they get the block grants they need for Medicare for all, so that this program can succeed in the future, so that we build upon the ACA and provide it for everyone as a single payer system, because we want to make sure that those private insurers comply with no exclusions, those pre-existing conditions, so that you don't have to worry about, I don't have that referral for this doctor, or it expired. I have to do 8 more pages of paperwork or go back and wait 2 more weeks to see my doctor. It should be a lot easier to just pick up the phone, get a web link, and talk to your doctor and get that new referral in, or have no referrals at all, which would be the ideal thing in the future. But like on the Eastern Shore, you're only stuck with one healthcare employer and provider. You have no Aetna, you have no, Kaiser Permanente. You don't have a lot of other choices, so there's no competition there And this is why so many people have left that practice and closed down, because there's nobody else working there on the Eastern Shore with you. That needs to change, and Medicare for All is going to be able to provide that by making sure the insurance providers comply with the federal standards that our citizens need, that we will represent in the future.
I'd like to just jump in there for a second. Michelle brought up an extremely important piece, is that the profit that the insurance companies are taking, and then that moves into Mia with the healthcare for all and the savings that we would experience if we had a single payer, if we took the profit out of illness. Why are we making money on people's illness, injuries, mental health issues?
Yeah.
We do that in foreign countries.
I agree. So my spouse had an accident, and anybody can have an accident, right? But you could have your health insurance provider from Florida and you live in Maryland, and the accident happens in Pennsylvania, but your doctor comes in from New Jersey. Who do you bill? Well, you get stuck with a $192,000 bill because the insurance just gives up on you. Now, here's the problem. It took nearly 6 months to get that all sorted out over a simple accident. These are some of the issues that need to be fixed, because guess what? We provide Medicare for All. It's a one-stop shop. We don't have to worry about all the different multi-state agencies and their insurances and the rules and regulations of compliances. We have federal compliance that they will be able to maintain with the government.
Michelle, did you want to jump in and say anything about Medicare for All?
So, I mean, if we're talking about how are we going to pay for this, how could we possibly, it seems so big and so huge. In fact, it would save us millions upon millions of dollars every year just to switch, well, yeah, I was trying to be nice. But yeah, I mean, it's a ridiculous amount of money it would save us every year. Nobody asks how much a drone costs. Nobody asks how much, how much the latest aircraft costs. Nobody cares about that stuff when we're talking about killing people overseas who are disproportionately poor brown people. And it is one of those things that, where are our priorities? If we had a Medicare for All system set up, we would have been so much better off and prepared for us to deal with COVID. I mean, absolutely, there's no doubt in my mind. You look at these other countries that have a single payer system, and they have this stuff figured out. It is done. It's taken care of. These people are tested, they're treated, it's taken care of. Here, it took forever just to get the testing done, because it's the profit. You've got people in it for profit, and you've already got people saying, you've already got pharmaceutical companies saying that they're going to charge thousands of dollars for the vaccines to the insurance companies. It's all a racket. It really is, and it's people getting rich, obscenely rich, on the backs of people's illnesses, and it's just not morally right, and that's not who we should be as a country.
Very good point. I think, Susan, I would like to kind of direct this question towards you and ask, what impact would Medicare for All or a single payer system have on healthcare workers like yourself?
It would totally cripple us. I know that sounds strange, but we already have 133,000 deficit of physicians, 150,000 fewer nurse practitioners than we need over the next 5 years. We do not invest enough in our healthcare providers. We've been cut back on funding, and we really need to fund the programs to educate our healthcare providers so that we are ready just for what we have, not even what we really should have. And that's where we need to go with this. Healthcare providers, if you stop to think about the Mayo Clinic, they pay their providers a salary. It's not on a percentage basis so that you do more procedures or more tests. so that you make more money. They've taken the profit out of it so that they increase the quality and the efficiency of care. And we can do the same thing with a single payer system. And if people want to have additional insurance over and above your basics, that's what they do in France. They have another policy that people who have more money may want to invest in. That's fine. But it would stabilize things for the providers. It would enhance the number and the quality of providers, and it would save the entire country money. The figures are there. We know they're there.
Absolutely. Did anyone have anything else to say on Medicare for All before we move into COVID-19?
Sure. So you, Susan, are absolutely correct. You know, there are a lot of people traveling right now as we get into this next topic of COVID-19 that are nurse practitioners and, you know, healthcare workers in general that are temporary workers that aren't permanent. They go from hospital to hospital, job to job, just as if it was a construction worker, you know, and there's no incentive for them to stay. And there's no incentive for anybody to go to a nursing school. And we need to be able to make that change. And this is why we have bills like Medicare for All to provide that training, that education stuff. And there's also, you know, maybe a harm reduction bill in the coming future, but it has to get through all the committees. But there's block grants in there as well to provide education and training centers to basically make sure that these schools are funding our future of those who are as passionate as you are to be in the medical field. You know, my stepsister works in a COVID facility down there in Norfolk, Virginia, so she sees it day in and day out of what it's like to see a patient pass away from COVID. And Lauren, maybe you can talk a little bit more about what you see as we get into this next topic.
Absolutely. Just to give everyone a heads up, I am Mia's campaign manager. I also am a nursing student. I currently work at the Baltimore Convention Center, Army Hospital that they set up for the COVID-19 patients. So I have treated COVID-19 patients, so I have a little bit of experience with them. So moving into that topic, regarding the COVID-19 response in Maryland, what do you think that we have done right, and what do you think that we can still improve upon? I guess go ahead, Mia, you can start us off and we'll move across.
Well, there's a lot of things that were done right. The governor did a good job leading us as a nation with the Governors Association, but also has kind of failed us in other areas like schools and other areas of testing so that we could have gotten what we needed to. Mandates should have been sooner. You know, if the president had intelligence and we had intelligence as well, he could have just, you know, said, oh, wait, we got COVID patients now. Mask mandate, travelers, stop, close down 95, close down 301, close down 50 and 13, close down 70. These could have, you know, helped Maryland so that we could have stopped the traffic and transit from New York, and those patients coming through that didn't know that they had COVID spread throughout the entire United States and continue what we see as a domino roller coaster right now. So the governor could have done a lot more, but he's done some things right.
Excellent. I'm going to turn it over to Michelle.
So, it's correct. I mean, right off the bat, the governor took this seriously. But I'm going to say this as a big God. He's dropped the ball. So he got the Korean tests. There was a big deal about that. Where they are, no one knows. They're not usable because they're missing parts.
I know where they are.
So it became more of a publicity stunt than anything else. And people still don't realize that. A lot of people, it hasn't made it as the news that it would have in any other situation with any other presidency going on. And then, you know, you're seeing him go off on a book tour and then kicking the responsibility to the county leaders, the county executives, and in an area that leans Republican, with a lot of Republican leadership down here who are in denial or don't think it's as bad as it actually is. I mean, look at what happened with Ocean City, with them opening up. You know, you've got these politicians in these smaller communities or at the county level who aren't taking it seriously and kicking it, you know, and by kicking the can to them and abdicating any responsibility and saying, oh, I'm just going to leave it up to the county executives. That's a complete dereliction of duty in my mind, because his job as governor is to lead, just like the president's job is to lead. The governor's job is to lead. And by saying, oh, not it, it's you guys, you're on your own, you handle it, you know, to do that, it's irresponsible. And that's, you know, the nicest thing I can say about it. So I think, you know, while it started out great and the optics were great, and like I said, that wonderful photo op of having all the tests on that plane and everything, in the end, it was just another typical Republican move.
I have to agree with you, Michelle.
Yeah, and then, hold on, one more thing I forgot. And you've got Andy Harris, who's in complete denial about it. Completely. He is on the far end of the spectrum. Yeah, I mean, he's on the far end of the spectrum, who completely believes all the conspiracy theories. You know, he doesn't, for a medical doctor, it's unconscionable for him to promote that this is no big deal and no worse than the flu. I can't imagine why he still has a medical license and goes out and publicly says these things.
Well, I know he doesn't have a DEA license, so I know he's not giving anybody any drugs. So at least
He's an anesthesiologist.
well, he doesn't have anything on file with the DEA. So
He gives anesthesia.
yeah.
That too much went to his brain. Running for office, so I'm saying it.
Oh, I agree. But man, that guy just was like nonstop. He was trying to reopen Maryland when we were in the middle of a pandemic, running around with a face shield on, no mask,
he came down
nothing.
here. He brought people to my neck of the woods. Yeah. He traipsed them from Baltimore all the way down to here, and I'm just
Frederick,
like,
actually.
Yeah, and I just, it blew my mind watching this reopen rally, and I just, it makes me so angry that someone like that, so irresponsible, is in charge of our response, you know. And you haven't heard Larry Hogan say a daggone thing about it.
Well,
he hasn't chastised it.
Andy Harris decided to join Reopen Maryland and suing the governor, which is him sticking his nose in the wrong business yet again.
Well, that's Andy for you, though, because he likes to get in everybody else's business except for what's going on the shore, whether it's our health.
Well, he's completely irresponsible. He has been completely irresponsible since he was in the Maryland Senate. And how he managed, I don't know what's going on up in northern counties, to have people think that he knows what he's doing. That Open Maryland thing was a fiasco. It was a slap in the face of every responsible adult to have him do that. And then he did an op-ed for our local paper, open up the schools. But as you were already saying, Mia and Michelle, there have been no standards set. Andy Harris, the doctor, did not provide any standards for reopening. The governor has not provided any standards. And in fact, the superintendent of schools has not provided the standards the schools need to safely open. So they're on their own. And it shouldn't be the responsibility of the county executives or the county council to set standards like that. So we have a whole series of irresponsibilities, and unfortunately or fortunately, it's the Republicans that are not looking to be responsible for the people that elected them. It's tragic. That's why we need strong Democratic leaders, Mia.
I agree,
You've got-
because
you-
even as a
Absolutely.
parent, and I'm pretty sure we're all parents here, is like we can't even get our kids out of school, okay, and get them to get a GED because the GED testing centers are closed, and we could have had our kids in online college already because of this pandemic.
Right.
You know, no matter if they're 14, 16, 18, or 13 or 19 years old, we could have had a bunch of Dookie Housers running around by now because of this pandemic, because they would have been in nursing school right now. They would have been in auto mechanic school. They would have been in aviation school. Heck, they could have even gone and become, a great farmer. It would have been awesome. But the governor shut everything down. And then Andy Harris was like, reopen everything, but nothing's open. So he failed. We need actual leaders that actually stand up, say, wear the mask, wash your hands, and vote Mia. Make a donation tonight, y'all. It's going to make it easier for us in November. But I'm pretty sure we got a lot more questions to go with before we dive more into Andy tonight.
Yes, so this next one actually is for Susan, just touching back on COVID-19 as a medical professional and someone in the medical field. What is your opinion on the best way out of this? I'm guessing the pandemic.
The best way out of it is the basic way. Put the masks on. Do the social distancing. Wash your hands. Stop having the parties. When 44% of the transmission is been identified as coming from family parties, family events, reunions, you know that this is a basic problem. It's something we can all stop, and that's how we have to move forward. We started in our office, we wore masks. We put it on the internet in the beginning of March. We took it seriously. I'm old. We've seen stuff. We've seen the swine flu. We know you go back to basics. What did Mom tell you? Wash your hands. Do it. Put the mask on. Do it. Not rocket science. That's what it is.
Yeah.
I
That's our way
absolutely
out.
agree. And as a healthcare professional, I think that it's out of respect for other people and frontline workers for everyone to, just do their small part.
Yeah.
So then I guess moving into our next subject with COVID-19, how can we ensure, because obviously we have an election coming up, how can we ensure that people are able to safely and securely vote amid this pandemic? This one's a current question for a lot of people, but I guess, Mia, did you want to kick this one off?
I think I can, but I want to ask the councilwoman, have you heard anything news? Because I have some news from the State Board of Elections about the change in the voting dates and us getting ballot boxes. Have you heard anything different?
I have not heard anything new. So if you have new information, I'd love to know.
Sure. So
You
we still want everybody to be super safe. We want you to vote by mail, okay? Get your ballot in, and we're going to have ballot boxes. We don't know where the polling places are yet, but the State Board of Elections is meeting again to tell us where those are. They're probably going to be at your local high schools or the State Board of Elections. And I have to say that it's now October 26th to November 2nd is when early voting will happen. So jot that down, October 26th to November 2nd, all right? And you got till from 7 a.m. to 8 p.m. to get your vote in. So if you're going to go vote in person, wear your mask. If it's cold out there, make sure you wear a jacket. We don't want you out there, in bikini and stuff and out on the beach, trying to vote in the freezing weather. That will be October. It'll be nice and 60 degrees then. I'm excited to get there.
Oh, I'm looking forward to that weather so much right now.
Me too. 100 degrees today. It's going to be great to get back to that. But we want people to vote, whether you're in person, like you told me through your texts, your phone calls, and everything else, or you can do it safely by voting by mail. You request it now so you don't have to get that application. That's what you need to do. So in the next week or two, request your ballot now so you don't have to worry about doing the two-step process with the application and then the ballot. You can still show up and vote in person. That's one of the nice things, that Election Day will still happen on November 3rd. We just want to make sure that all of our election judges are safe. So maintain your social distancing standards. And if you're shopping, it's 2 shopping carts. 2 shopping carts, not 1 shopping cart, and not standing side by side. But think about that. When you're in the polling line waiting to vote, if you're going to go vote in person, 2 shopping carts distance between each person is about 6 feet, okay?
Yeah, and check with your friends to make sure that they've requested their ballots.
There you go.
So, absolutely, bug your friends, be that pain in the rear, and ask them if they've requested their ballot yet. And you just because you care and you want to make sure they're safe. I think that's incredibly important. We need to let people know how to vote safely. And I'm going to be requesting my ballot. I haven't done it yet. I know I'm kind of slacking. But, if you're like me and you're in a situation where you're trying to avoid being in public if at all possible, absolutely make sure your friends know how to get their ballots. Send them a text with a link. I think you guys just put the link
Yes,
in the chat. So send them Mia's link and get them their ballots. Make sure that people are ready and able to vote.
So definitely tell mom, dad, grandma, grandpa, cousins, aunt, brothers, sisters, sister-in-laws in half, brother-in-laws in half, great aunts, great grandmothers, godparents, angels, demons, whoever you believe in. Tell them all. Text VBM to 77788. That's how they can also request their ballot. It's texting in this modern day, or go to miadmason.com/vote. And Susan, I'm pretty sure I'm missing something.
Hand washing.
There you go.
We through Talbot County, we sent out last week all the announcements on the early voting and on the ballots. And I also noticed we've already applied for ours. I went for the electronic ballot. So that's available as well. So everything has been made very easy. Just take the time. It took 2 minutes. Fill out the form, put a stamp on it. We actually delivered it to the election board to make sure it got there.
Yes.
Yep. And last but not least, when you're all done, sign it and drop it off. Go back to your car. We'll wash your hands again. That's the safest way to make sure that you stay safe with COVID. And just don't walk away, then take off your mask. Keep your mask on until you get safely into your car, safely into your home.
Thank you, guys. So we did have one other question come in. It's a little bit kind of related to COVID in the sense of it's another crisis going on right now, and that's the opioid epidemic that's facing America, and especially Maryland. So to reduce harm and help people and families affected by addiction, what kind of plans do you think we need to implement to promote safety? Whoever has the first suggestion can go ahead and kick it off.
Well, part of the problem, because we do deal with a number of people who use opioids on a daily basis. They get up, they go to work, and this is a segment of the population that we have ignored. We tend to find that they are working class men. They have been working since they were in their teens on construction jobs, moving heavy objects. By the time they hit their 40s, they're back. They have degenerative disc disease. They have spinal fractures. They have quite a number of physical ailments. They've had surgeries. They've been to physical therapy. They've had injections. And they start using opioids because they've been told there are no other options or their insurance will not pay for the options. And so they support their families with pain medication. The other group that we have is trying to get off of opioids. And I will tell you, people discriminate very strongly against people who use opioids. And so they are denied help, or they are looked down on, or they're made to feel like less of a person which makes them more anxious and more depressed, which starts the cycle, Mia, that you were talking about with our veterans, many of whom have had serious, serious injuries and rely on opioids or get hooked on opioids because of those problems. We've got to acknowledge the cause and then really support them mentally, physically, and spiritually in order to move through this. There's no one easy fix.
And we were talking earlier about legalization. Medical marijuana has been something that we've used for my son for his epilepsy. His official diagnosis is Lennox-Gastaut syndrome. It's extremely rare. It's less than 1% of epilepsy cases. So, making it available to more people, it's a lot of hoops to jump through, and it's expensive. It's very expensive. To go through that process, you have to go to the doctor. It's not covered by insurance, so you have to pay cash out of pocket. If we legalize cannabis and allow people to access that as a source of pain relief, I think you're going to see a huge drop in the opioid addiction numbers. We need to give a safe alternative, and cannabis is that safe alternative. And that's something that we need to do as a state and something we need to do as a nation. And we need people like Mia in Congress to get that done.
I absolutely agree, because there's also another part of, the opioid crisis that often gets ignored is the programs that are like abstinence, and it's just like sex education. We don't provide education about the opioids. We don't do enough. We have DARE programs. We have this war on drugs to basically take everything away from you, your paraphernalia, your civil rights, your life insurance, everything, your health care, just because you had to find an outlet for the pain that you were in, or you needed that medicine but needed to afford it and had to go to great lengths to get it, and then you get pulled over as soon as you leave a dispensary. That's wrong. We need to be able to change that, and I would love to co-sponsor a bill to tell you about tonight. It's HR 2569. And what that does is it provides that training and education center to provide all of these resources, provides block funding for many programs. It provides jobs that we need right now in our economy. And of course, it helps the Medicaid program that is super critical to help us legalize things like this, because the FDA, the ATF, and DEA, they grow their own medical marijuana. It's hard to say that 3 times fast. But we also need to be able to provide the stuff that will be life-saving to those so that they don't overdose, which gives them a place to safely inject or to safely use the product. And the way that we can have the accountability and the funding for it is to legalize it. If you go into CVS and you ask for Sudafed, the 2 things that you need is your driver's license and your credit card. And the way that these drug companies want to make money and be profitable is their product. Well, let's give them something to sell, which is their product, more legal products for them to be able to have, so that our CVS's and Walgreens don't go bankrupt and continue to shut down and leave us without the medications. Because sometimes we even get our medications to the mail, and even we see that right now being tampered with by our president. So our healthcare is going out of business, our pharmaceutical companies are going out of business, our farmers are going out of business because they can't grow any medical marijuana. We need to give everybody an opportunity here in America, and it starts with getting us elected into Congress to provide the representation not only to our shore but to America, to stand up and get rid of this America First propaganda that we see and actually make us the best country in the world, because this is who we are. This is our home. This is our land. This is our legacy. This is your vote. And as a veteran, your friend, your advocate, this is what we're fighting for. This is what we're going to DC and lobbying for. We already have 6 other great co-sponsors from Maryland supporting this. So I would be your 7th. to support this bill if elected. It will make a life-saving change for everybody, regardless of their age, to continue going to work, provide a job, and keep people in business. I think that's the American way. I think that's the Maryland way to move us forward.
Excellent. Thank you, Mia. Did anyone have any other closing remarks that they'd like to make?
Vote for Mia. Vote.
Please vote for Mia. You know, we're talking about the cannabis issue. You know, may I remind you guys that Andy Harris, rather than worrying about what's going on in his district, gets involved in DC's laws for medical cannabis all the time. And it's like a pet project of his.
Yeah.
Let's send him packing. He can do that stuff on his own time, not on our dime. Let's
Same
send
with
him
women's
packing. He
healthcare.
can go take care of that little hobby. We'll get Mia in Congress and get the health care that we deserve.
Yes, let's do it.
Excellent. Well, we look forward to seeing you all this November. Thank you so much for joining us tonight.
Thank you.
Bye, everyone. Have a
Thanks
great
for
night.
having
Be
us.
safe. Wear those masks.
Absolutely.
Please. Open the whole base.
Face mask.
I'm Ian Mason. I'm running for Congress. Our voters are at the helm in 2020 because our education has failed us. Our infrastructure has failed us. With your driving force, we can fix that, especially in our healthcare, because your vote actually matters and you have the choice in 2020. I'm Ian Mason, and I approve this message.